안녕하세요. 미사 웰치과 임상철 원장입니다. 大家好，我是韩国웰牙科医院的林院长. Hello everyone. It is nice to see you all again. I'm Sang-Cheol Lim. I'm private practitioner and periodontist from South Korea. I would like to welcome all Dentium users participating in this Dentium's live surgery show. For today, our live surgery will be implant placement with minimalism concept on lower posterior region. Our operator today is Dr. Chung. These procedures will be introduced with flapless surgery and bright tissue-level implant pictures. I hope this surgery helps you in developing your treatment concepts. Thank you. Well, let's take a look at today's case. Today's case, actually, I mentioned already, lower posterior implant placement with minimalism. As you can see, it is a panoramic view of our patient, upper fully edentulous area situation and lower partially edentulous area. And this one is a CT scan. As you can see, from number 47 to number 37, all the CT scan views are very loose trabecular pattern, right? Cause of this patient, elder person, right? So we can see from this CT scan, sharp and knife edge style, top portion of the ridge, and loose trabecular pattern. So it means softer bone. Okay, so some portion buccal concave and depression, as you can see, especially number 47 and number 37 area have buccal depression. This one is intraoral scanning. From this intraoral scanning view, we can see more clear all the ridge shape and the position. So number 44 area have some buccal depression and soft tissue depression, and the residual ridge about number 36, 37, and 46, 47 have a reduced ridge. So this one is intraoral view. As you can see, I already mentioned about this number 44 area buccal depression here, and a little bit gingival inflammation, and also this patient warned about the removable partial denture during long time. So the posterior mandible with the reduced ridge. So today's surgery plan looks like here from the bright implant system. So first guide drill insertion, and then from the final drilling, and then after final fixture installation with the NTI tissue level implant fixture. So after insertion, the ordinary connecting with the scan comfort cap looks like here. So this scan comfort cap have a dual function. First one working as a healing abutment. Another function, the properly this intraoral scanning jig, working as intraoral scanning jig, right? So we can make temporization, temporary processes immediately, and the final restoration also with very comfort situation. About this bright tissue level implant, actually these implant pictures very unique, as you know. So external connection type, external 20-degree connection type, so built-in type, built-in screw abutment type, a unique design of especially top portion connection devices. So this tissue level implant has a thin and deep thread design, as you can see, so we can get easily higher insertion torque, primary stability when we have softer bone insertion, right? This is very important factor to have immediate implantation, early loading, or some another different kind of situation. So we can use these advantages of a unique implant system from right tissue level. So today's surgery plans are here. I already mentioned about upper dentition is fully edentulous and lower partially edentulous. So we have 3 implants of right mandible area, and 2 implant fixtures insertion will be inserted on left of patient lower mandible. So bright tissue level, all of this, and the minimal invasive implant surgery concepts will be done, and ideal location of implant based on the CBCT. This CBCT from the bright CBCT from the Dentium company, very highly upgraded recently. So automatically nerve detection functions are added from the AI. So just click, one click, it means automatically these machines detect inferior alveolar nerve, right? So it is not manual type. So it is highly upgraded version. So sometimes nowadays, actually, we can use these functions very comfortable during the surgery, especially very tight posterior ridge area. Okay, this one is similar case. So as you can see, upper anterior edentulous and lower posterior, the both of posterior edentulous situation. So checking the ridge shape and the remnant of the bone volume and the height from the CBCT, and starting with the drill, and just very simple step of final drill, just or 1 or 2 final drills are enough for implant placement, especially this bright tissue level system, and insert with the NTI tissue level implant system. So that's it. Actually, this case, similar case, also has done by Plavlis surgery. So no Plavlis flexion, just taking an insertion point, making an insertion point, and Lindemann drill first, and checking the pass, and final drill and implant insertion. Very simple step. This bright implant system have a lot of advantages. The one of advantages is a simple step for the surgery, right? So 3 implants on the right mandibular area and 2 implants inserted left mandibular area. So both of them are all the tissue level implant system, especially this bright NTI tissue level implant system has give us highly strongly primary stability when you have insertion, especially softer bone also. Anyway, we can get easily higher insertion torque. So it gives a lot of advantages to make the early loading for the temporary prosthesis, also final prosthesis either. Let's see the provisional restoration here. After enough temporarization period, we can move to finalization, right? So when we have a final restoration, I already mentioned before, scan comfort cap connection is very easily to make a final restoration, especially a monolith step. So nowadays, as you know, intraoral scan and monolith the procedures are very prevailed, right? So the final lastration inserted the panoramic view and intraoral scan, intraoral photos. Okay, this one is a similar case too. What do you think about this lower left lower area? Actually, lots of teeth are missing, so we need the implant fixture. So anyway, this case needs minimally 2 implant fixture for supported zirconia final lastration. Number 5, 6 maybe. But the point is here. What do you think about the buccolingual width of the ridge, remnant of the ridge? Actually, it is not enough, right? So we have to consider about these ridge widths. First, how can we make enlargement and enhancement of ridge widths? So, or we can go either way. It means another way. It means just the minimal invasive surgery concept. It means minimalism, right? So this elder patient need the minimalism concept. So just only 2 anti-blood implant system connect with the comfort cap and final lastration. So as you can see, let's see what they think about this one. Very simple and very the short period to final lastration, right? So sometimes we can choose like this simple way instead of the fully augmented and with a GBR or some another complex procedure. So sometimes like this, simpler procedures are better for the patient. So final lastration looks like here. Just only slimmed, small diameter to implant inserted for final lastration due to narrowed ridge, right? Okay. So after scanning, intraoral scanning, the CAD/CAM scanning, and design, and final lastrations with zirconia with a custom abutment right here. Okay. Okay, let's move to the surgery room. Okay, already Dr. Chung is starting to have a surgery about number 44 area. Okay, so now Dr. Chung is using the high-speed bar, the tapered Fisher bar, to make insertion point. Okay, he's going to have flapless surgery. Okay, after making the insertion point and change the drill with the Rindemann first, and the Rindemann drill until 11 millimeter. So when we have a flapless surgery, we have to consider the thickness of gingiva, right? So before starting the drill, checking the thickness of gingiva. So use the periodontal probe, checking the gingival thickness, and then final drilling depths will be decided, right? So after insertion, number 44 area with Lindemann and with insertion, the parallel pin, checking, considering the neighborhood. Okay, so he is moving to left lower mandible area, make incision. Yeah. So I think he is not going to make a flap reflection. Just tap incision like this, small tap incision, and then detecting the ridge. Maybe he wanna checking the ridge using interdental light or the periodontal curette will be useful. Checking the ridge, but as you can see, the very thin gingiva and the mucosa area, so just a small scratch. Okay. Yeah, he is making high-speed bar. Okay. After tap incision, detecting the ridge shape and location, and starting with the Lindemann drill. All of these procedures, the starting from the reading the CBCT. Can you remember before starting the surgery, I explained about each location of CBCT view. So all the shape and natures with the rich areas should be reminded when we have a surgery, especially flapless style, right? So checking the top portion of which, and then we can imagine from the CBCT view and the reality. So we have checking some of the discrepancy between the realities of bone shape and the CBCT view, and matching each other, so that we can consider about all the surgery procedure according to the surgery plan, initially from CBCT view, right? So lower left area is already done, and the move to lower right area. So he using the high-speed taper bar, the proper positioning. Okay. I think right side, the lower right mandible area have a little bit wider keratinized gingival tissues compared to opposite side, right? That is why flapless and the small tap incision. You understand what I'm saying, yeah? So this right lower areas, he doesn't need any tap incision for slightly the gingival reflection and detection. So just pointing, drilling, and the final drilling here. Yeah. Before implant fixture insertion, he is checking all the fixtures recipient areas parallel using the parallel pin, right? He is making all the implant fixtures with the same parallel, the same direction. So before implant fixtures insertion, he is checking the parallel using this parallel pin, right? So he wants to make a parallel the insertion all of this implant fixture. Actually, these NTI tissue level fixtures can be compensate a little bit the deviation from the center of the axis, but the Dr. Chung is not going to have a deviating insertion. Just he wants to right angles and the same parallel position and situation. He wants all implant fixture with the same parallelism. So can you see the number 9 and 11? It means diameter. So we can imagine the final restoration's diameter, right? So the middle of this diameter with a parallel pin. So if we make this point insertion with the implant fixture, the center portion of final restoration, the central groove or functional cusp of the final restorations can be kept. So, checking all these three-dimensional view, three-dimensional position, and starting implant insertion. Actually, this number 44 area slightly reduced. Actually, reduced the buccal depression, as you know, as you can see. So we can consider about these the buccal augmentation, right? So there are many different types of buccal augmentation procedure. The first option is the contour augmentation concept with GBR procedure. It is suggested by Dr. Daniel Buzer. So a GBR procedure with the variant, the bone grafting with a membrane. So another options, we can make a small vertical incision around this depression area and detaching the periosteum from the surface of the bone using the instrument, and then make a pouch and make a room, right? The holding the graft material, and then through this vertical incision area, we put the graft material into the pouch. So-called pouch technique. At this time point, like Western free collagen binded grafted materials, the frequently used, the collagen graft material, right? So-called. But today, Dr. Chung skipped this procedure, just only the minimal invasive surgery, concentrate on the minimal invasive surgery with the minimalism concept. So, number 46, already done. Number 47, is inserting with the NTI. Okay, so actually number 44, tissue level, diameter 3.5, 11 millimeter are inserted. And number 46, diameter 4.0, 9 millimeter. And number 47, 4.0, 7 millimeter tissue level implant were inserted at each point. Okay. In my concern, these bright anti tissue level implant fixtures the optimize with the flapless surgery, right? So if you want to have flapless surgery design, flapless surgery surgical plan, I suggest you choose a tissue level bright anti implant instead of bone level.
그래도 4.0에 7mm, 5mm. 7mm 하나, 5mm 하나.
Yeah, so Dr. Chung have decided the length of the final fixture. Number 36 area, 7 millimeter. Number 7 area, number 37 area, he is going to have a 5 millimeter short length implant fixtures. Cause of the higher the running of inferior alveolar nerve, as you can see before. So he is Dr. Chung have decided short implant fixture on number 37 area. Okay. So especially like this elder person need minimal invasive surgery due to his higher age, right? So we have considered about the treatment option. First one I already mentioned before. As I mentioned before, the fully contour augmentation concept, like a GBR procedure. The other options are like this, a minimalism concept. I think this minimalism concept better than fully augmentation procedure, especially to elder person. Okay, a short implant 5 millimeter. Due to the high running of inferior alveolar nerve, as I mentioned before. The minimalism, actually it is on the term of, it is not the term of dentistry. Actually, as you know, the art field term. So this minimalism, an art movement in sculpture and painting began in 1950s around the year to emphasize extreme simplification, right? So we adapted this concept to dentistry field. So especially elder person, the reduced bone grafting procedure and skip the complex surgery procedure. We just do the implant fixtures, to fix it, and that's it. So it means let's do something, get more something concept, right? Let's do something to do something, but let's do something, but we can get something more. That is a minimalism concept. So if you want to adapt this concept to your patient, you need a tool. The first tool is a picture system like this, the tissue level, the narrow diameter but stronger than the same size diameter of bone level implant. So Dr. Chung choose this tissue level implant. This tissue level implant, the smaller diameter, even though one size is smaller, but the equal or the higher strength compared to the bone level implant. That is why today's all the fixtures was tissue level implant, right? So already done connecting with this the healing cap. Okay. Actually, this tissue level implant, the auto stop function, have an auto stop function. It means the shape of implant fixture have a neck portion, have some concavities and the built-in type abutment design. So when you have a 7mm drill and then put this implant fixture into the socket, the ostomy side, so just tightening, and when the top portion of the ridge crest contact to this the platform area, built-in type abutment level, so just to stop. It is impossible to insert down, right? So this it means auto stop function. So it is a big difference between this built-in type tissue level and bone level. The nowadays ordinary tissue level implant very resemble like same internal connection type to the Straumann type, right? The internal 8-degree, the Straumann connection type, as you know. So the internal connection, even though the tissue level, it is prevailed nowadays, but this bright tissue level have an external connect type built-in screw abutment style, and this big difference. Okay, so connect with the comfort cap. This comfort cap working a dual function. First as a healing abutment. Second, working as a intraoral scanning jig. So you can see the sum of the notch, plain notch. Okay, very simple. All the surgeries was done. Yeah. So the doctor's happy and patient also happy. Yeah? The minimalism concept. So gave us all to make happy. So sometimes we can apply this concept, surgery concept, to our elder patient. I strongly recommend you. Okay, these areas are the small incisions, not flat reflection, but just the small reflections. Can you remember? So the Dr. Chung make a suture. The Dr. Chung prepared to make a suture, modified horizontal and vertical matrix suture type. The buccal side, horizontal style, and across the ridge and the lingual or palatal area, he make the vertical matrix suture styles, making a knot on the buccal. So very unique type suture. And finally, PDRN injected around this surgery area. This PDRN the subside all the swollen area. So make comfortable and reduce the swelling. So feel better, feeling better after surgery. Okay, thank you for watching this surgery. Okay, so let's take have a 10 minutes break time. I will be back in 10 minutes. Thank you. Thank you. Now we have checked the post-op CT view. As you can see, number 47 area. What do you think about this area's insertion? Very nice, well done here. I already mentioned about this area, 7 millimeter. So a top portion of ridge have a little bit, the small portion of cortical and some trabecular pattern. But the lower part is, as you know, so very loose. So it is not good bone quality. And also, the lower inferior alveolar nerve is running so high. So Dr. Chung have decided 7 millimeter. Number 46, also the same, 9 millimeter. So as you can see, this all of both areas well done and very nice, the parallel and the opposite dentition compared to opposite dentition. So what about the 44? Actually 44 area is very tricky. I mentioned about the buccal depression, right? So in this CT, cone beam CT view, the buccal areas have some the buccal bone plate here. So I mentioned before, as I mentioned before, younger patient need contour augmentation, right? So at this time, Dr. Chung skipped the buccal contour augmentation cause of elder person. But anyway, number 44 is a good situation as I expected. So number 36, yeah, very well done also. Oh, so I want to make some comment about this number 37 area. Can you see the red dot? This red dot from the automatic nerve detection function from a bright cone beam CT. So bright cone beam CT have upgraded nowadays. So automatically this nerve detection function added. This function operated by AI. So accurate and simple and easy, very comfortable. So just one click means we can see clear this inferior alveolar nerve running. So due to this tight close, this inferior alveolar nerve running, so he have decided 5 millimeter, right? So actually the inserted area from into the alveolar bone 5 millimeter, but top portion 2 millimeters with the polished surface, the total length 7 millimeter, but inserted area into the alveolar bone 5 millimeter. So another version of a 7 millimeter NTI tissue level implant. But anyway, we can use 5 millimeter. So 5 millimeter insert to alveolar bone and top portion of this external connection type have a very strong rigid style, looks like here. So all of these implant fixtures well done, very parallel, and the ideal positioning, even though flapless surgery without the surgical guide, right? So like this situation, if we want get this very nice final result, first we have to consider, we have to read precise the cone beam CT view. So we need know what about the ridge shape and ridge type and bone qualities and anatomical landmark positions. All of these informations should be recognized by cone beam CT view, and then the experienced, right? Surgeon's experience is a very important thing to have a freehand surgery. Okay? Okay, so yeah, this one is intraoral scanning. intraoral scanning after surgery view. So we can see clear the proper positioning or not of implant insertion area and reach shape and reach the position, the implant position on the ridge. All of the things are very clear understanding on this intraoral scanning view, right? Okay. Now we have one question. Question is, when do you use short implants? Is it okay to proceed with prosthesis? Absolutely yes. Of course, yes. So, first of all, actually, the indication for short implants doesn't matter. The internal connection type, external doesn't matter, right? Tissue level, bone level doesn't matter. All the short implant, like a 7 millimeter, especially this today's tissue level 5 millimeter. First, reduced lower posterior is a first indication, cause of the inferior alveolar nerve, right? Number two, which is another indication, this short implant, actually, right? Upper posterior maxilla, due to maxillary sinus, right? If you want to have just a small sinus lifting or not, just put the implant picture like with the minimalism concept. You can use also a short implant instead of longer lengths. But we have to consider about this short implant. When we have using this short implant, we have decided choosing this short implant. First, crown implant ratio, right? Shorter lengths like a 7 millimeter or the 5 millimeter, doesn't matter. Actually, nowadays, under the 7 millimeter, we have categorized short implant, right? So, anyway, short implant need the proper, it is impossible to proper crown implant ratio, but we have to consider, right? So, another considering factors are primary stability. Primary stability is very important factor. So, undersized drilling or some drilling technique modified best option to have a higher insertion torque with the primary stability. Why? Because of this shorter implant, the contact area is smaller than regular size, right? So I recommend you, if you use a short implant, anywhere of your patient, doesn't matter. The solitary short implant have some risky, especially posterior maxillar, right? So I recommend you strongly more than 2 implant fixtures should be inserted when you use short implant. And number 2, splinted each other, right? 2 short implant splinted with superstructure is better condition, better option to you, right? First, avoid solitary implantation with a short implant. Number 2, if you can, more than 2 insert and the splinted, right? So this is the key using the short implant for your patient. And the final process is also achieved by the normal procedure. So crown implant ratios, the limitation of crown implant ratios, according to the European EAO consensus, as you know, 1 to 2, right? It means the one portion of the inserted the picture into the alveolar bone, and from that point, maybe 2 times bigger superstructure containing with platform areas accepted, right? So it means 1 to 2 portion is acceptable. In Chinese, EBR concept you have to keep in mind when you use a short implant, right? Okay, for a long time watching this live surgery show, thank you, and I deeply appreciate you. Okay, we will have a next live surgery the April 15th, same time. Thank you. Bye.